Hi, I'm Julie Ponto. I'm a professor of nursing at Winona State University in Rochester, Minnesota, in the United States. And I'm here at the IMON 2019 conference to talk about oncology survivorship care plans. So oncology care has gotten so complex, and often patients and families finish up their treatment without knowing what are the key next steps. So in the US, we've started using a program called Survivorship Care Planning to help patients better understand the treatment that they've received and the recommended follow-up after they've completed treatment. We found that these documents also help in the care providing team to provide better care and communicate more clearly among all of the different care providers. So a survivorship care plan includes generally 3 components. It includes what the patient has actually already received, or the planned treatment actually, before they receive the treatment. What's the plan for the different modalities of treatment? So do they plan to have surgery? What type of surgery? Do they plan to have chemotherapy, radiation therapy? And so all of those components of the plan of care are documented clearly so that multiple providers can view that plan. Then the next phase of the survivorship care plan is to document what the patient actually received. So did they receive the oncology chemotherapy care as was planned? What drugs did they receive? What were their doses? Did they have any side effects, and what were those side effects? It's especially important to document significant side effects such as hypersensitivity reactions or severe toxicities. And then the treatment summary will also include other cancer treatments that they may have received. So if they underwent cancer surgery, what was the surgery? What were the results of the surgery? What did the pathology state? Were lymph nodes involved? What's the staging of the cancer? And so it really gives a good summary of the actual treatment that the patient received. And similar also the radiation therapy, if that was administered to the patient, the survivorship care plan will often summarize what that radiation treatment entailed, the field of the radiation, the dose, the total cumulative dose, and again, any unwanted or any side effects that the person experienced. And so those are the first 2 components of the survivorship care plan. Then the last component of the survivorship care plan is the follow-up treatment plan. So many more of our patients are surviving their cancer diagnosis. In Brazil, I think there are over 1 million cancer survivors currently, and growing because our treatments are getting more effective. And so after people receive their cancer treatment, they go on to continue their lives and need follow-up care for both their cancer and for just general health screening. And so the follow-up plan communicates any cancer-specific screening that is recommended for the individual, and it also details any common unrelated to their own cancer screening exams that are recommended for them. So in total, the survivorship care plan really provides a wonderful summary of the treatment that the person received, the recommendations for follow-up, both to monitor for recurrence of the cancer, but also to evaluate their general health needs, and then serve as a communication tool among the many providers of care that the individual may interact with. So survivorship care plan is really a great tool for both patients and families and our care provider team.